Everyone, good morning. My name is Navdeep. I am back with another topic which is going to be very helpful for nurses working in community, or whether they are working in the hospital or with the general practice nursing or aged care scenario. This information is going to provide them or equip them with the essential information that they can educate their patients or their clients on, because often they come across scenarios when there are public holidays or it's a weekend and there is restricted availability of health services. So what can be their options when circumstances like that arise? And I would like to highlight here that this is applicable to Australian healthcare scenario to begin with. So let's start the presentation. Now, we should have knowledge about what to educate to our patients when they need health advice after hours. There are lots of online options available, but the thing is, a lot of them are not known to a lot of our clients, and some clients cannot access them because they may not be computer literate and they are living alone, or the next of kin is not available on that day. So we have to prepare our patients for these kind of situations when they can access the health services as they need in after hours or public holidays like that. So we need to tell them what services they can call, because all services cannot be contacted for all type of reasons. So we are going to talk a bit more about that today. Here are some examples for, per se, it's a public holiday. Like we have recently gone over Easter weekend, which was a long weekend, and a lot of our patients faced the difficulty that there was restricted access to the GP clinics because of their hours of opening. So there were issues around getting repeat prescriptions, getting medical advice if they were on certain medications and they were experiencing some side effects, or they needed some help with the wound during that time. So ideally, as community nurses, I would suggest that we educate or remind the patients that they look up to their prescriptions and scripts before the public holiday time comes or long weekends come, things like that. So they are not affected. But in case if there is still a need, then we should be focusing on what are the options for them. Now, for all medical emergencies, of course, we know 000 emergency departments are always open and available. So, in case of a medical emergency situation, we cannot talk about these after hours options. We can only say to them, if it's an emergency, call 000 straight away and call for an ambulance to take you to the emergency department nearby. Medical emergency can be someone having a stroke, someone having a episode of myocardial infarction, someone involved in a road traffic accident, a severe bleeding, going into shock, burn injuries. These are some examples of medical emergencies where we shouldn't be waiting for anybody or waiting for the doctors. We should straight away call an ambulance. But other than that, for non-emergency situations, we have after hours GP. Sometimes most of the GP clinics have the posters, advertisements placed on their walls, but sometimes they are not always read by all the clients, patients, or staff, and they are not aware that they have options to call after hours GP. There is a nurse on call, which is a phone call, phone assistance. Sometimes they can even go to their nearby pharmacies. Some chemists may be able to assist with certain common ailments or certain common medications. There are urgent care centers in the suburbs nowadays, so a lot of clients of us are not aware of these. And then there is a new thing which is called VIC, Virtual Emergency Department. This is for Victoria State. I'm talking about Victoria, Australia. So there is a virtual emergency department where you can avoid the waiting periods actually sitting into the emergency departments. These virtual emergency departments are for non-emergency. I am focusing on non-emergency again and again. Please don't call virtual emergency if you are heavily bleeding or having a heart attack or stroke, or these are actual emergencies where you need to present to emergency department, whereas for non-emergency situations when nothing else is available or you're not sure, you can even register into VIC virtual ED, virtual emergency, where there can be a telephone consultation provided to you, including a video consultation for your ailments. So these are some snapshots from certain websites like Doctor Doctor. This is the links in the top red ribbon are the actual links that can take you to the websites. So if you hover over them, you see these hyperlinks coming up with drdoctor.com.au. So these are bulk billing after hours doctors in Melbourne. You can go to their website and you can log in online and request a after hours GP, and they can either contact you by phone or may visit you at home. Then another option is calling in 13 sick. So that is also a after hours doctor's bulk bill. Bulk bill means you're covered with Medicare. So 13 sick is the number you can call. It's the largest, most trusted Medicare bulk billed after hours doctor service. Let me clarify that I'm not promoting any companies here. I'm just making these slides for providing education to our clients, our patients, because most of them live alone and they don't know who to turn for advice if there is a public holiday or it's a weekend or after hours emergencies arise. Nurse on call, which is a 24/7 service on 1300 60 60 24. This is again a snapshot of that website. Contact a nurse on call if you want to speak to someone over the phone or need an advice on whether you should seek further medical help or any suggestions about your medications and things. Sometimes your pharmacies may be open. Not all pharmacies are open, so you can check online which is the nearest pharmacy which is still open, and sometimes pharmacists can advise you on certain minor things like having some wounds and stuff if you don't want to go to a medical center or emergency for such small things. There are urgent care clinics which have come under primary health care, and these are also called primary priority care centers. So simply go on the website for Victoria. This is health.vic.gov.au and search for the nearest primary priority care centers, or they are called urgent care clinics. They provide GP-led care to people who need urgent care but not an emergency response. You can't go to them if someone in your family is having a heart attack or a stroke. That would be a waste of time. These are time critical emergencies. But other urgent care stuff, like if you need someone with epilepsy needs their prescriptions refilled and their usual GP is not available, or the medical center of their usual GP is closed, that is the next option for them. So that can be a one scenario where you can access urgent care clinics which are available and open till late after hours. So these can be checked on this website health.vic.gov.au. You simply put in the your name of your suburb, or you put in the pin code of your suburb or postcode of your suburb, and it will show you the nearest or the nearby primary care centers you can go to. You can even go walk in those centers. You don't even need to book an appointment. Next thing is Victorian Virtual Emergency Department. This is a snapshot from the website. That's how it looks like. So it's a free statewide service in Victoria, Australia. I'm repeating, I'm talking about Victoria, Australia. It's a free statewide service. If you are contacted, if you are having a non-emergency situation, like recently I had a scenario where GP prescribed certain antibiotic to a little baby, a little child, and they were having some rashes and diarrhea as side effects of that antibiotic, and mother needed some help around whether to continue or stop the antibiotic and needed some advice around that. So it was non-emergency because the baby was feeling well, active, cheerful otherwise. So we called in the nurse helpline, and the nurse directed us to Victorian Virtual Emergency Department. Being a nurse myself, that is the thing that sometimes you can't remember everything. That's why this is something I want to all the nurses to know, that these are the options, and these are really the life-saving and beneficial options that we can educate our clients on. So they don't fill your routine prescriptions or medical certificates. It's like actual medical assistance, but non-emergency thing. Like I gave you an example. So we got into the queue. We got consult from a pediatrician via telehealth. They looked at the rashes via the telehealth, and the mother was feeling really peace of mind at the end of the consultation because she was advised to discontinue the antibiotic, and she was given the really good advice like keeping up with the fluids and stuff. Baby was afebrile, everything was okay. So these emergency services, you might have to wait for some times, but you get an advice, a health service in the comfort of your own home. You don't have to go and fill in the waiting area in the emergency department. You can do that wait at home as well. So, but it is not for life-threatening situations. It is not for immediate emergencies. That's why these are some important things we can advise our clients to, and these may be useful for them. According to Australian Institute of Family Studies, 1 in 4 Australian households is a lone person household. Means 1 in 4 Australian home has a person living alone in those houses. And this is a data from March 2015 from Demographics of Living Alone. That's why if we are giving this valuable information to our clients, because often they are on multiple medications, they need refills, they need advice, they may be experiencing some wounds, or anything can happen. Medical emergencies, non-emergencies can happen. So these are the things we can advise them, and that's what they can use. Always educate their patients about decision making, because they are accountable as well for their own health, and we always involve our clients, our patients, into their care. We don't always tell them what to do, we always discuss them, discuss every option with them. So we don't tell them do this, do this, do this, and we don't do that bossy kind of healthcare. It is a partnership. We are partnering with the patients, their families. So education is a part of that. So we are educating them on a bigger picture, not just telling them that you go to your GP every time for if you need help, even if they are closed, how they can go to the GP. So that's why it's very important to teach them about these options. Hope you like this information, and hope that's going to be valuable for you and for your patients. Thank you.